Here I am. Here we are. Yes, another week.
In this video, we are going to talk about Community Preparedness Plan. So the learning competency is to develop a community preparedness plan, and the specific learning outcome is to know the four themes in disaster risk reduction management framework that will help them in creating their own community preparedness plans. So last time we have talked about the good practices for DRR, okay? So the National Disaster Risk Reduction and Management Plan aims to provide policies, plans, and programs to deal with disasters in the Philippines. It also serves as the principal guide to disaster risk reduction and management efforts to the country. The framework envisions a country of safer, adaptive, and disaster resilient Filipino communities toward sustainable development. Now, there are four themes in the RRM framework. First is the disaster prevention and mitigation, disaster preparedness, disaster response, and lastly, disaster rehabilitation and recovery. So, we are going to discuss it one by one. Let's start with disaster prevention. Disaster prevention is the outright avoidance of adverse impacts of hazards and related disasters. So basically, it expresses the concept and intention to completely avoid potential adverse impacts through action taken in advance, such as construction of infrastructure to eliminate certain risks, right? So we can also regulate the land use. So we should not permit any settlement in high risk zone. So another example is we should make use of seismic engineering designs that ensure the integrity of building in an earthquake. Okay? Next, we have disaster mitigation. Disaster mitigation, from the word mitigation, this is the lessening or limitation of the adverse impacts of hazards and related disasters. So, mitigation measures encompass engineering techniques and hazard resilient construction, as well as improved environmental policies and public awareness. Next, we have the disaster preparedness. Disaster preparedness talks about the knowledge and capacities developed by governments, professional response and recovery organizations, communities, and individuals to effectively anticipate, respond to, and recover from the impacts of likely imminent or current hazard events or conditions. So we also have the disaster response. The disaster response is the provision of emergency services and public assistance during or immediately after a disaster in order to save lives, reduce health impacts, ensure public safety, and meet the basic subsistence needs of the people affected. Now let's go to disaster rehabilitation and recovery. Basically, this is the restoration and improvement, where appropriate, of facilities, livelihoods, and living conditions of disaster affected communities, including efforts to reduce disaster risk factors in accordance with the principle of build back better. When we say rehabilitation, these are measures that ensure the ability of affected communities and or areas to restore their normal level of function by rebuilding livelihood and damaged infrastructure and increasing the community's organizational capacity. So the concepts of the thematic areas that we discussed are not mutually exclusive. So the concepts and activities involved overlap. So they have no clear distinction over time. Okay, so why?
When I tell you what I'm about to tell you, you will be told my opinion.
It's because they mutually reinforce each other. So activities under each of the areas may affect each other. For instance, appropriate prevention and mitigation can complement the level of preparedness in a community, right? So they do not, should not, and cannot stand alone. Equal attention should be given to all areas. And finally, they don't really have clear starting or ending points. So activities can be under several priority areas. It reduces people's vulnerabilities and increase their capacities. So remember, the outcomes of the activities could be focused on a specific area but should be considered as a part of the whole plan. This slide shows a table which lists the activities involved and illustrates the overlap between the different thematic areas. So, to better understand how this applies to disaster planning, let's discuss the roles and overall goals of some government agencies in the context of the four thematic areas. First, let's have disaster prevention and mitigation. So, under this, we have the Department of Science and Technology, or the DOST, right? So, the goal of this is to avoid hazards and mitigate their potential impacts by reducing vulnerabilities and exposure and enhancing capacities of communities. Okay? Another goal is to reduce vulnerabilities and exposure of communities to health hazards. And lastly, enhance capacities of communities to reduce their own risks and cope with the impact of all hazards. Under disaster preparedness, we have the Department of Interior and Local Government, or the DILG. So, the goal of this department is to establish and strengthen capacities of communities to anticipate, cope, and recover from the negative impacts of emergency occurrences and disasters. Another goal is to increase the level of awareness of the community to threats and impacts of all hazards. Next, they aim to equip the community with necessary skills to cope with the negative impacts of a disaster. Another one is to increase the capacity of community and develop and implement disaster preparedness policies and plans. Lastly, is to strengthen partnership among all key stakeholders. The third thematic area is the disaster response, and under this we have the Department of Social Welfare and Development, or the DSWD. So, the one goal of this is to provide life preservation and meet the basic subsistence needs of affected population based in acceptable standards. Another goal of this department is to decrease the number of preventable deaths and injuries. Next is to provide basic subsistence needs of affected population, and lastly is to immediately restore basic social services. And finally, the last thematic area, which is disaster rehabilitation and recovery, has the NEDA, or the National Economic and Development Authority. So their goals are the following: restore people's means of livelihood and continuity of economic activities, restore shelter and other installations, reconstruct infrastructure and other public utilities, and assist in the physical and psychological rehab of people who suffered from the effects of disaster. Okay, I hope you were able to take down notes, screenshot, and if this is effective, you may subscribe to my channel and turn on the notification. Share this channel so that we can, vibe.
No, I don't need it.
Okay, so let's have an evaluation. So I will show some activities, and you have to identify which thematic area a particular activity falls under. Okay, number one is risk and hazard maps. Number two, strengthen rescue operations. Number three, disaster risk reduction in school curricula. Number four, design and construction of resilient school buildings. Number five, more efficient insurance system. And number six, increase community capacities. Okay, so please finalize your answers. Okay, so number one, we have risk and hazard maps. So this is under prevention and mitigation. So some of you might answer preparedness. This is also correct because again, the thematic areas may overlap. Number 2, strengthen rescue operations. So this is under response. Good job. So for those who weren't able to get the correct answer, try again. Watch the video again.
No ma'am. No ma'am.
Number 3, DRR in school curricula. So this is under preparedness. Number 4, we have design and construction of resilient school buildings. This is under the preparedness or rehab and recovery. Number 5, more efficient insurance system. This is okay. Mitigation, preparedness, recovery, or response.
Mali na naman!
Lastly, increase community capacities. So this is under mitigation and preparedness. Okay, that's all for this video.
Guess who's gonna subscribe? Moi? Yeah.